I would advise people, anybody who is starting like an online program, before the thought of clinicals even comes up with your program, you just start asking people. Start texting your friends who are NPs, start talking to people, like, would your pediatrician that you love, for your kids, would they take a student, and just like you said, start tapping into your network.
Welcome. Part 2. Oh my gosh, you guys, this is gonna be a juicy episode. Okay, so no need to reintroduce Natalie. You guys already know her. But today, this particular episode, I actually feel like is probably one of the most valuable ones I have put out to date, just for the fact that it really goes into a lot of dynamics. We're going to be talking about nursing burnout, transitioning into new nursing roles, tangible NP grad school recommendations and resources. We're going to be talking about balancing nurse expectations. We have a really honest, open dialogue here about the many paths nurses can take. This is really the modern day nursing perspective. We really go into a lot about the NP dynamics, and we just get real on this one, you guys. So sit back, relax, and I hope you guys enjoy this episode. After working in our ICU setting, some burnout, and we're just gonna get real here because we want to give you guys all the juicy stuff. Let's talk about some burnout and then your transition into, because I know I have had a lot of questions specifically about grad school and the reasons I went back, and just sort of like, and I think you and I have such a similar feel about this, and I want to get your perspective on it. So let's talk about it. Being a PICU nurse for X amount of years and then moving into your role.
Yes, 100%. So burnout. I don't know if I knew what burnout was when I was experiencing it. I think at the beginning I was so gung-ho and I was so positive. I was trying to do everything in the unit. I wanted to do this, and I wanted to train the new grads, and I wanted to be the spirit team director and all the things,
yes, exactly. And I wanted this and take on that,
right, and pick up the extra shifts because we're short, and work those 16-hour shifts, and
overtime, come in early, stay late.
And at the beginning, it's great because you're learning and you're young.
And there's a little element of that is kind of like, it's hard because it's kind of, that's the element of you're earning your stripes. And I do believe in that. I actually believe in that. I'm very firm about, you got to earn yourself in medical because, until you've been in the code, until you understand it, until you've had until you've been in these situations, I get it. But there's a balance.
And I think I've actually had like a history of doing this in my life where I go 1000% in, and then I just hit a wall, and you like hit that wall, and then you're like, crap, now I like can't do anything because I've put all of myself into this, and I'm doing what I noticed was I was doing work outside of work, which I think is okay sometimes, but like because we are like a clock in, clock out type of profession, when you're doing work at home, you're just taking away from the exercise that you could be doing and the time that you're spending with family and friends,
refueling yourself,
right? And the way that our hospital's set up, and maybe other hospitals are set up differently, but you have to do all these like activities in order to climb the clinical ladder,
and to get your raise,
and so then you end up doing a lot of work sometimes. And I'm not saying to not do it. I just think I maybe went a little bit overboard with it.
Well, I have a very strong opinion about this that I've touched on it a little bit, but I feel like sometimes the magnet, every hospital is going for magnet. And for those of you that are listening, magnet hospitals were designed back in the 80s to help improve satisfaction with nurses at the bedside. It was like basically it's a way for hospitals to say like, we're magnet and our nurses are amazing and they're fabulous and they have all the things. And part of that is, your nurses are bachelor's prepared. Your nurses are all certified. Your nurses are participating in evidence-based practice. Your nurses are doing it's like it's more and more and more. And I literally feel like that expectation is burning nurses out.
Yes, 100%. And we're kind of getting paid for it because we're doing those extra things, and then you get that little like a $1, $2 an hour salary bump, which can help, but it's like, oh my God, at what cost, you know?
Yeah, I mean, okay, and the reality is we're in the business of humans. We're in the business of healing, and that is such an energy exchange that we don't talk about at all in healthcare, and I feel like it's starting to come out a little bit right now, but truly, I will tell you, like, when you are trying to heal someone and you're working so closely with these families and you like feel for them and you're doing all these things and you're trying to be the best provider you possibly can and earn your stripes and all these things, it can be very wearing.
Mm-hmm. And then at the same time, you're like responding to emails at work, you're doing modules on work time, you know, you're doing
which takes away from patient care, by the way.
You're charting up a storm, you are, you know, filling in whatever you need to on your whiteboard, because that's kind of what I don't know, that's like what they want you to do these days. And so there's all these like little things that kind of, I think, bog us down as nurses. We're not able to just, it's not like Florence Nightingale where we're able to just care for the patients. Now we have this like electronic charting.
Yeah, it's not, her nursing isn't what it was like even 20 or 30 years ago. It's very different. I feel like the expectations are just, they're up, which is great, and it should be. But at the same time, like, there's this balance, and I think it's a really, really important to acknowledge the burnout in your own self, or to see it, or to understand it.
Yeah.
So you don't get to that point.
Right. And I think I needed a little bit of travel nursing, a little bit of something to like look forward to and to work towards. So that's why I decided to go back to grad school, and that's why I decided to do travel nursing. Not because I didn't love the PICU and the people that I worked with in the PICU, because I absolutely adore them, and it was hard to leave. Yeah. But it was one of those things where if you notice yourself like going to work, just like I don't know, kind of like going through the motions. Yeah. And then at home, I wasn't very nice to Eric, and I wasn't nice to my roommates that I was living with. Yeah. And I kind of just needed a little change of pace, you know? Same. And maybe if I had like kind of gone into it a little bit slower and just did one thing at a time and didn't try to be this like crazy type A overachiever that I always am, maybe I wouldn't have, I don't know, maybe I wouldn't have like burnt out. But I'm glad for the things that I did and the experiences that I had when I took myself out of that environment and I got to go other places. Now I'm back at that hospital, and I'm like happier than ever because I've kind of worked through a few things, and I've gotten to, I don't know, like
finding your outlet and take a breath and figure out what you really want. So let's talk about your decision to go back to grad school. And before we preface this, I really do actually want to say this. There are so many nurses out there that love their jobs. And so this isn't like us saying you need to go back to grad school. That it's not at all what we're saying. I just love highlighting the amount of amazing things that are out there and the reasons why people choose to do what they do. And I think we have these conversations to open up the dialogue. So it's not a push for grad school by any means. It's just everyone has a different story and a different journey, and I think it's important to highlight. So let's talk about it. What was your decision? Like, let's go into the deets.
Yeah. So the deets on this. So we kind of touched on this earlier, a little bit burnt out. Working holidays and weekends and 12-hour shifts is absolutely amazing sometimes, you know?
Yeah.
You get those 12-hour shifts done, and then you have 4 days off. You can travel, you can chill by the pool, you can go to brunch on a Tuesday with your friends and, you know, sit in a pool with a floaty, which I did all of the time. But I think one thing that I started to realize that started to bear down on me once, you know, Eric and I started to get a little bit more serious, talk about having a family. I was like, oh, do I want to do this every year where I have to say, Eric, should I miss Thanksgiving or should I miss Christmas this year? Or shoot, I have to like go through this whole process of switching my shift because I'm working on this Saturday that this person's bridal party, you know, happens to fall on. And so even though I think at the beginning of everything, when I first got out of nursing school, I was like, I will never work a 9-to-5 job. Like you can, you know, and now I totally am like, oh, there is something to be said for a routine, not missing holidays and you know, things that are happening on the weekend. So that was kind of one thing. My second point is kind of an unpopular opinion, but I actually really love school. And I know you are so opposite. We are like yin and yang on this.
Yeah, we are. It's where we differ.
I am a nerd.
I love
and
that.
I love school.
But that's like a lot of, I mean, first of all, many medical are. I mean, that's the reality. It's like, I wish I was more like that. Let's be honest. I wish I was more of a student. So.
Right. I love the lectures. I love the studying. I love the tests. Like, whatever, you can come at me and think that I'm like a horrible person, but
I love that. I love that dynamic, and I wish. I mean, okay, let's put it this way. I love. I love the learning. I love the learning. I love this new pace. Or like new diagnosis, getting to the pathophys. I'm so engaged in that. How medications work, what to give, when. You know, like that's. I love that. I hate the tests.
Yeah.
I hate the tests. I hate the assignments. That's where I really just like, ugh.
Yeah. And I mean, honestly, I think I'm just really lucky because I enjoy it and I'm good at it, you know? And there's some people who are really good at tests and really good at school. And there's some people who are not, you know?
Right.
And both make great NPs and both make great nurses. You know, it's not about grades, but I'm just one of those people who was...
Shout out to all the people who love school.
Right.
Sam is like that. She came out. I feel like Sam really likes school. She's the one. She's the transport nurse that came on, you guys. She's good at it too. Yeah.
And
I'm just not, but that's okay. There's a lot out there that are.
Yes. Yeah.
Thank God.
Yeah. And so I really liked it. I thought that I was going to go straight from nursing into getting my NP because I had no idea like that you really do need experience before you go back to school.
Let's talk about that dynamic really quick. Okay, so we're going straight into, you guys, the grad school concepts here. So, there used to be a dynamic in healthcare where you could choose to be a nurse practitioner and a PA right away. And I think that was maybe 10 years, maybe even like less than 10 years ago where you could do that. Now, I would say majority of the programs, most programs I know of out there, the nurse practitioner ones, you have to work at least 2 years in a field that's related to somewhat similar to what you're going to as a specialty.
Right, because a lot of nurse practitioner programs, actually all of them, they are population based. So you'll notice that there's pediatric nurse practitioners, there's family, there's neonatal, you know, whereas
CRNA, midwife.
Right. They're very population specific.
And they're getting even more specific. It used to be, I think there was not, there's a handful. There was women's NP, there was family, there was this, but now you're getting even more into, okay, we have pediatric NP, but you also have an acute care pediatric NP. So it's becoming even more specialized, which is why I think it is really important, as you said, to get your base in nursing.
Oh, yes.
Doesn't matter what setting, but just at least come in and understand the nursing model. Understand the dynamics, start understanding healing, like holistic care, how we're thinking of things. That's really important.
Right. And a lot of people ask me like, well, why didn't you just be a PA? Like, why did you choose NP? But just like logistically, when you look at the certain classes that you have to take and the route to take to get to those, my nursing degree does not really fit on that track to get a PA, you know.
PA is medical model.
Right. And so,
it's different.
So nursing and all of my classes set me up to be in this like nursing model. So we have a holistic kind of point of view that you touched on earlier, where our idea is that we treat the whole patient. We look at not just them, but their environment and their job and everything around them. And the medical model, which is tried and true and also great, is more disease-based. So it's like, what is the disease? Let's treat the disease. And PAs actually, even though afterwards you can specialize, I was described PAs, and maybe this is totally wrong, I was described PAs as they are like stem cells. So once they graduate, they're like a stem cell, and whatever they want to go do afterwards, they evolve into whatever physician they are working with.
Yeah. So it's actually interesting you bring that up, because I actually think that when you become a nurse, it's a very similar concept, right? So nursing is very general. When you become a nurse, when you sit for your boards, doesn't matter where, you sit for your boards and you become a nurse, and then you gravitate somewhere and you pick your specialty. In NP world, you have to go in knowing that is a specialty you're going into. You have to pick it because, this is why I was very strategic with the way I chose mine, and as you were as well. But I think that's because we understand our bases and what our goal is. Like, what you basically have to know when you're obtaining your nurse practitioner license, you have to know what is your goal. Or at least have some idea of like where you want to go with it. Everyone's journey is different, and there are so many different jobs out there. So, let's just put that out there. But I also feel like that's kind of a big concept difference between PA and NP for sure.
Yeah, 100%. And I think, so I chose pediatric NP primary care coming from the PICU world, which I get a lot of like, and you chose FNP
family.
from the NICU world, and a lot of people are going, excuse me, what?
Yeah.
And so I think that this is the perfect time for us to talk about it.
So you chose, explain why did you?
So coming from the PICU, I think we kind of already know that those are the sickest kids in the hospital. I started to realize, one, that I want to try to keep these kids out of the hospital. A lot of what we were seeing, like drownings, asthma exacerbation, trauma, that, vaccine related things like measles and tuberculosis, those are all preventable outpatient.
Correct.
And I was like, heck yeah, I like that. I love the education. I love the idea of digging the well before you're thirsty. And that, I think, especially with children, you can do so much preventative care. And I am like all for preventative care. Our US health system is so reactive. Oh, you have high blood pressure? Like, oh, let's give you this medication because you're already, overweight and you have high blood pressure and you eat bad and you don't want to work out because you have bad knees or, all of this stuff. Effect. Everybody knows, where the US sits and like our health and diet and all that stuff.
Right.
So if I can go all the way back to the beginning and teach these kids and these families healthy foundations, healthy things to help them grow and be the best adults they can be, with the outcome that they're not going to be using our healthcare system the way that maybe some people do now, So it's, if they're healthy and I teach them that early, and we teach healthy nutrition and what proper servings look like and exercise and all of that, then we prevent the hypertension, the obesity, and then this one, like, obviously we have healthier people coming around. We maybe have happier people. And that's really what I wanted. That's why I went into primary care. I wanted to keep those kids out of the hospital. I wanted to interact more with healthier kids, I think, too. Because I love kids, but seeing them sick is not always the same as seeing them, when they're thriving. And I really wanted that relationship that I didn't always get when I was in the PICU. How we talked about before, where it's like you kind of like you come in and then as soon as you're getting healthy, you leave. I would love to see, from that newborn visit, the second day, or like that first day when you're visiting them in the hospital, the baby is born, all the way until they're leaving you because they're going to high school, or they're going to college or something. And you've just watched them thrive. I think that's super cool.
And then to answer the big question that I know everybody wants to know.
Drum roll, please.
Drum roll. Why I chose family nurse practitioner over neonatal nurse practitioner. So when you're looking, as we spoke to the dynamics, when you're speaking about neonatal nurse practitioner, so you're pretty much signing up for acute care inpatient exclusively. So that's not to say, I brought on Karen Rapport, who she works in a level 4 NICU, and she actually, one of her girlfriends who is in an NNP reached out and did say she works outpatient. She does actually, you can do that with your NNP, but after a certain amount of months, that you cannot care for anything over sound. It's out of your scope, essentially. Your scope of practice is very narrow. You're also signing up for, as an NNP, you're going to be intubating, you're going to be putting in central lines, you're going to be the resource, you're going to be everything. And for a while, I really thought that that's where I wanted to go. I did think that that was a very serious way, but honestly, when I go down to it, I just currently right now have just a hospital burnout. I just feel this true, it's not a patient thing, because I love my patients and I genuinely love going into work and working with my families and my patients, and I love that. It's just this hospital burnout. The grind of it and doing it every day, and after 8 years of working in the hospital setting, I just am genuinely ready for a new setting, I think. So that being said, I had to really think about what is my intention, what is my end goal. And my goal at this point, I, like you, started seeing some very similar things, but more in the women-based area, as well as pediatric. So women being, seeing some of the trends that are going on within the maternal aspect of women don't know or not prepared mentally if something goes wrong in their pregnancy, how to set themselves up for things to go well, because things don't always go well or perfectly. And I just feel this real need and draw to support women in a different way, women and or babies. And I would like to do that outpatient. I feel this real draw to be a preventative care provider. However, I couldn't choose between women's health, which is specifically just for women, and or pediatrics. I couldn't decide. I'm like, I wish there was an NP program out there where you could combine women and children, but there isn't. Right. So I went family, and I don't know exactly where it's going to lead quite yet, but I do know my intention is to be outpatient primary care in a setting and or maybe even hospitalist, I don't know, setting. I'm kind of toying with some ideas, but I want the opportunities, and I want to do it before we have kids. I want to get through the majority of my schooling before we have children.
Yes.
It's a lot of very strategy. Like, I'm strategizing my education. I'm strategizing what my goals are. I'm strategizing the patient population that I kind of want to serve. I was looking for jobs online and just kind of trying to figure out, like, okay, like, are they hiring these, women's versus family versus, so doing a lot of research. And I think those are all really important aspects when you're talking about going back to grad school. I know so many nurses, actually three nurses who all started grad school and then either quit grad school or decided a whole different route, like towards the end of their program, because they figured out it wasn't what they wanted. And I think that's something to be said for just really understanding what you want out of it. I like my freedom. I like to be able to choose. I love patient care. I like the idea of being a resource. I like the idea of helping people in a very genuine way. And having that graduate degree is really, to me, the next step of how I wanted to advance my career. And I feel very ready for that. I'm now 31. I do wish that I had gone back probably like when you did. I wish I had gone back. Yes.
Years old-ish.
Yeah.
Well, I guess I was 27.
I wish I had done that. And I had the advice of two girlfriends who actually saw this in me a couple years ago. They were like, Tori, you should go back now, meaning probably about 3 years ago now. Yeah. They were like, you should go back and just get the degree, go and just do it. And I wasn't ready. I was like gun shy on it. I was like, I'm not ready. I don't know. And, and to be honest, I really didn't know. But at the same time, I'm like,
oh, shit. If I had done that, I would have already been done. Yeah, for sure.
And I wouldn't have, because I didn't recognize my burnout early enough.
Yeah. I know. Well, and I think something else too to be said to that is not just burnout, but kind of when you're saying like, oh, I'm not sure.
Yeah.
I kind of hear that like uncertainty that I identify with, where when I started applying to grad school, I'm like, oh gosh, there are so many other nurses who have been a nurse longer than me, who I see as maybe better nurses or more experienced. Like, why aren't they going back to grad school? Am I not good enough to go back to grad school? Like, am I not smart enough? Do I not have enough experience?
Yeah.
And so I think, like, I don't know about you, but like those questions went through my head. Yeah. Like, is this okay? Like, will people trust me? And by the time I got into the program, what I kind of forgot was that I'm still a nurse as I'm going to school. Like, a lot of these programs are geared so that you can go to school and you work at the same time, which we both are doing or did in my case. And now I have, almost 6 years of experience as a nurse. And so, and now I'm done with school. But that being said, I'm so proud of you for going back to school.
Yeah. Well, and you were the person that really actually pushed me. There's a couple other nurses. There's 2 other nurses on my unit that I should have been in their program with them. But anyway, you know, this year thing too is like there's just so many things out there. I mean, when you're talking about nursing and like the healthcare sector is just, it's expanding astronomically. You know, I mean, we're going in so many different places. There's so many different new things coming out, and I think it's really cool. And I also think getting back to basics is really important.
Yeah.
And being a true, like, being a medical professional and to say, hey, like, I know that, you know, McDonald's every now and then is fine, but let's talk about like how it affects your hormones, how it affects this.
And we have that like young energy that even though we don't have experience, we can kind of like reinvigorate like a practice or just come in just like ready to learn and like ready to go.
Yeah.
I can actually totally see you just in this like outpatient setting where now, like we were talking about, so many of these NICU babies are surviving.
I know.
And now they're, you know, we kind of try to get them out of the hospital like as soon as possible, you know. And then all of a sudden it's like, okay, boom, 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 bye.
Yeah.
Follow up with your primary care and you have this appointment, whatever.
Totally.
You could like serve such a good role in an outpatient setting that is just like, those are my peeps. Like, let me tell them
and
like
really
what to expect, you know, like, okay, this is how they're going to wean your oxygen. This is how they're going to wean your LASIK.
Yeah. And
like,
I will say we don't explain a lot of that. We don't explain so many things.
Right. We were learning about that in school, and I totally thought of you because we were just talking about these like NICU grad babies, and I was like, oh my God, yeah, we have to take care of these babies. And so it's just nice to have that experience now from being in the NICU to know that like, okay, yeah, these are they might come home on Lasix and they might come home on oxygen. And just all of those, you know,
but then
little
I
things.
like get to, okay, and this is where we go wrong in medical. A lot of times is like, for example, I like to tell parents, I'm like, okay, your baby's going to go home on oxygen. Can you do me a favor and picture your life? Like, okay, car seat, how are you going to do it? What are you going to do when you get home? What happens when you need to go to Target? Right. What happens when you need to go, you know what I mean? Like you literally, I like, that's to me where like, I love talking about the full picture. I'm like, let's get to, or hey, like, do you know where to refill your prescriptions? Do you know the number for this in case something happens? Do you know, like these are where, I mean, especially being a nurse for so long, you just know to ask these questions because you're like, I know this is what you're going to ask me. Right. Yeah. And I know it's going to happen.
Yes.
Because you know, things get really lost in translation in healthcare, period.
Yes,
this is the problem we get so many things lost in translation. People don't understand their medication regimens. They don't understand the purpose. They say the white pill. Well, why are you taking the white pill? I don't know.
Right. Well, and you know what's so crazy to me that I didn't really realize until I went to outside of the hospital is when you're in the hospital, it's like, oh, okay, here's your patient, pull them up. Oh yeah, it looks like you were in the emergency room and then you went to a specialty care clinic because you're part of this network and I can see this and I can see that. I can see everything. I can see all the notes. And then all of a sudden you're outpatient and maybe you're not connected to that network. And the patient's like, oh yeah, well, I went to urgent care 2 weeks ago. Like, don't you know? And you're like, no, I don't. It's not connected, you know? And I think, like, unless you're like with Kaiser, you know, where it's all connected and you can kind of see everything. Families just don't know that.
No, they don't know.
And the medical field, we are so behind on the times, you know, just with stuff like that. Like there are places that are still using paper charting that still are not on that network. And then to top it all off, everybody uses like a different charting system and a different system to like keep everybody's medical records 100%. In. So we're like, we're all over the place.
You're fishing
Our poor
for anything.
Patients. I mean, being a patient is exhausting and like trying to figure all that out. So it's kind of nice for us that we have, I don't know, we just have a little bit more experience in not only like the
dynamics,
hospital, but like healthcare system. You know?
I agree. Like I do think it gives you a full picture of the beast. Healthcare is a beast, you guys. Like it's a huge thing, you know, and it starts with, and I think it's important to get your foundation in your unit and to be overwhelmed in a moment and to become a really good nurse initially and then an expert nurse and then And then you need to get the full picture. And then you need to start figuring out how to make it even better. And I think that's our obligation. Like, that's our obligation in healthcare, is to make everything continue to be better. I get really frustrated by stagnant thinking. I get really frustrated when someone's not willing to try something new, when, you know, there's new things coming out and someone says, well, I don't need that certification because this is how we do it. I'm like, no. Actually, this is probably going to teach you something X, Y, and Z. You know, here's a new med. Let's try that. Maybe it's better than what we're doing now. You know, things that we're doing now are going to be so different from 20 years down the line. And I think the idea of, you know, for me moving into this space of being the resource and leading in that area is really exciting. I want to be there. That's where I want to be. My target audience is most likely going to be either women and or pediatrics. I don't know which. We're going to find out and we're going to see, but that's my ultimate goal, and I'm really passionate about it. And I think, you know, now more than ever, we need more providers with an open mind to try new things, to get more progressive, to get up with the times, kind of like what you're saying. I love modern day healthcare thinking. And I also love a really old school approach with, you know, utilizing our Eastern, Western medication or, you know, medical thought approach, being holistic. And I think it's really important. And so that's the space I really want to go into. And I'm really excited about that.
Yeah.
But
I'm excited too.
And anyway, yes.
Oh, well, what I was going to say is the nice thing about nursing, and one of the things that I love the most about it, let's say you finish all of this and all of a sudden you're like, oh, I don't like being an NP. Like, I don't like this role. Cool. You go back to bedside or you can become a clinical instructor there's like so many things that you can do.
Because you have your master's, MSN. Once you get that MSN, I mean, regardless, both you and I, you'll have your MSN on my MSN. You're going to be a PMD and I'll be an FNP. Yeah. So that, I mean, that's a great point, you know, if you hate it. And I do know nurses who have gone back, who have practiced and become a nurse practitioner and did that for a couple of years, and you do it and then you hate it and then you go back. Oh, well, there you go. You did it. And then it makes you appreciate your setting of wherever you go even more. You know what I mean? So I think that's where I just really support every kind of journey, because I mean, if that person hadn't gone back and gotten the degree and she hadn't practiced in that area and done that, there's so many things that she probably wouldn't have learned. And then bringing it to that setting back. You know, I mean, there's just like a lot of perspective to this that I think we just don't value enough.
Yes. Yeah, 100%. And everyone, like you were saying, everyone has their own journeys. I had people in my class, so we had like a small cohort, maybe like 13, 14 people that were doing the pediatric NP program. And we had somebody who had been a nurse. I think she said she was a nurse for like over 30 years. Yeah. Like, you know, she had all of this nursing experience. And then she's like, this is terrifying for me. Like, I don't even know what a Google Doc is, you know? And like, but she did it, and she is awesome. She's going to be great, you know? And then we also had people who, one just had her baby. She's like, you know, pumping during class. And we had somebody else whose wife just had a baby, and he had like a newborn. And anybody can do it, and anybody can figure it out. Is it probably more ideal for me that I didn't have responsibilities and a mortgage and, you know, all of that stuff? Yeah, it was. Totally. But that was like you were saying, it was intentional. So
that was a
just
big
get
question.
It done.
Yeah, no, I agree with that. I get this question a lot from new grads coming up of how much time or how much experience do you think you need to be either NNP or FNP or whatever. So my general rule of thumb is I do think just minimum 2 years. I think that's just like a base, like just nursing 2 years. But I, you know, to that degree, I also think if it's something you know you want to do, like just go for it. And I'm a supporter of like, you know, just do your journey and you know,
and make sure the program is a good program that you're not just gonna like fumble your way through and you're gonna feel like, okay, what did I just learn? I do know nurses that have done that. They're like, this is what I've wanted to do, you know, and they do it. And by the time you're done, because most programs are like 2 to 3 years long, you've just tacked on that experience because you've been working and that's great, you know, and I think that's super cool. Do I think it's a good idea to go from school straight into NP? Hell no. I'm so sorry. No. Some people have asked me about this, and I feel so bad. Just kind of like, I don't mean to crush your dreams. No. And
I think you
maybe
need to-
maybe it's just me. I don't know. But
No,
like,
I think most nurses out there who are working if you're working, I agree with that. I don't know. I think you need to get your
NP
experience.
school, it builds off of the fact that you know what you're doing, and you know, like for PNP, when I'm by myself and I walk into a clinic and I see a 6-month-old who has RSV, you know, or who, whatever, they come in because they have a cold. Like, I don't even know what they have at that point. Can I look at them and say, are you sick? Do you need to go to the ED, or can I treat you in here? You know, you have to
let's
have
also
that,
talk
like,
about dynamics, because I think this is really important to bring up. So when you're talking, like, for example, nurse practitioner versus PA, right? PA school is a full-time gig, I'm pretty sure, for 3 years. PAs, like, you are working in the, like, you cannot work. Like, their whole thing is school, right? Like, that's it.
Right.
Our foundation is very different. And so I think when you're talking NPAs, I think the expectation of clinical hours is ridiculous. It's a lot. I can't even speak to the amount of hours it is, but I know the dynamic of learning as a PA, and then your expectation working is very different. When you're talking nursing, our education level is a bachelor's or an ADN. And then you're working in the so what I'm getting at is it's a shorter amount of education time, but you need to get those clinical hours. You need to get the foundation before you really go back for that upper level degree.
Yeah.
Whereas PAs, they're putting that time in.
Right.
And so is medical. They're putting the time in. They're putting the education in. They're putting that in. Like, either way, you're going to have to put time in.
Right.
So my point is like, you just really need to get that foundation, as you said. Like, you need to understand dynamics. You need to understand populations, medications, like how things work. I think it's really important to get that. And I think any nurse nowadays, you know, there's so many ways to go, but you just really need to have that.
Right.
Before you...
Oh, 100%.
You know.
Yeah.
The other thing I was going to say is, if you do decide... So let's say, like, this is to my... Because I know I've had this question so many times. NNP. So if you know you want to be an NNP, right? And you're not a NICU nurse yet. Okay. So I think a really important dynamic to also address on this is, if you are going to go NNP route and or specialty CRNA or whatever, you really need to be careful about the school you choose. If you're going to go back right away, or you're going to go back, right, let's say you're 2 years in and you're like, I know I want to do it. Just be very aware of the school you're choosing, because it does affect your clinicals. It affects your dynamics. It affects everything, which we're going to go into right now about classroom versus online. Mine's obviously online. Yours is classroom. Okay.
Yeah.
So if I was to advise a NICU nurse who's 2 years in, should they go to my school? I don't think that would necessarily be the best idea, especially if you're in California going to school in Texas. Why? Because it's a totally different dynamic than a classroom setting. I think you just have to be very strategic about the grad school you choose. I chose mine very purposely.
Same here. I mean, yeah, you kind of have to, like, know yourself to know what type of school that
your
you learn
skill level. Yeah, what your school provides. All very different dynamics.
Yeah.
So let's talk about that. So you chose PNP,
Yes.
and you chose your school. Let's go into that. And
Okay, so one of the reasons that I chose to go into a classroom setting was because I just know myself, and that's how I learn best. I have never been diagnosed with ADHD, but I swear when we were learning about ADHD, I was like, oh, yep. I need structure, and I need regimen, and I basically need to be out of my home environment where I can just grab my phone, you know, go on the internet. I don't think I had Instagram when I was in nursing school. Like, the dynamic is just so different, you know? So I was like, if I'm going to do this, I really need to be in a classroom. Two other reasons that I chose it was, in our area, so many of the PNPs or FNPs who work at our hospital came from this program. The director of the program, I'm going to give her a shout out because she's amazing. Her name's Dr. Natalie Adame. She's the director of our PNP program. Love her.
Everyone knows her.
Everyone knows who she is, and that she prepares the PNPs that come into this program like nobody's business.
Right.
And so all of those NPs who have graduated, when they meet you and you're like in clinical, they're like, oh, is Dr. Sheffer still there? And you're like, yeah. And she's like, oh yeah, she's really hard, but you're going to be a good NP. Like, you're going to be prepared.
Right.
So it kind of had that, like, okay, I know if I go here, it's going to be hard, but it'll be good. Right. And it was nearby, so I was like, okay, this is what I want. It was a state school, so I think like $4,500 a semester was kind of...
Yeah, the cost is a big thing.
The cost was a huge thing. Yeah. And then most importantly, like I would put a giant star asterisk, like I'm doing one in the air right now. They provided clinical sites.
Yeah, that's a big one.
It is like such a big deal.
Yeah.
And as you know, I had no idea that the clinical site thing was like that big of a deal, but it is freaking cutthroat. Like I've heard of people in other online programs that cannot, for the life of them, find somebody to precept them.
Yeah, we're going to see how that goes. So a flip side, so mine is an online program. In my program, I will say, I feel you on the ADD thing. I'm 100% ADD. I mean, people know this.
I know. And I know people don't like us to use like, oh, I'm ADD or
loosely,
whatever.
But
it's not politically correct, but everyone knows what we mean.
You know what I mean.
Yes.
You know what I mean. And, okay, so the way I do it and the way I thought of it, first of all, was to let everyone know as a base, your grades start expiring after you graduate.
Yes.
And I was 7 years out of school, and a lot of programs already were going to expect me to go back for statistics and patho.
No,
and
thanks.
so I knew, I was like, oh my God, like literally the ones that I wanted to go to, I was like, I can't, I literally physically can't do it. Mm-hmm. So, you know, to me, going back for more school was just even more like, whatever. So, that ixnayed a lot of schools for me automatically, because I was like, any school that I was going to have to go back for, that I was going to have to do extra classes for, done. The other part for me is I just have so much going on right now that honestly going into school every week just wasn't going to fit my lifestyle. And there's a lot of nurses and there's a lot of people out there. You have kids, you have this dynamic, maybe it just doesn't work for you, right? I will say something that I have to do I have to sit myself down and I treat it like how people do, like for example, Natalie, right? I knew she was going to school on Mondays, 8 a.m. to 6 p.m., right? Or whatever the semester was. So I basically treat it like that. So every Monday I block off that as a school day. I don't work. I purposely make my schedule so to mimic people who are in those classroom settings.
That's super smart.
And, you know, cost was a big factor as well. Mm-hmm. Length of the program was a big factor. I was referred to my program by a girlfriend who, she was a nurse, a NICU nurse. She was actually from Texas. And she had done the UTA program. And
what is UTA?
So she was like, hey, like I'm an FNP. She's an FNP now, working in California, and she had highly recommended it. So, and they're accredited. So I was really picky and very specific about the program because I wanted to make sure it was a good program. It was credible. I know a lot of people from the South do this program as well. It's just, as far as an online program, it has really great reviews. So I decided,
for sure. If you're getting a master's degree from an online program, you don't want some you know, crappy school that it like. Yeah.
Ooh. Well, the other thing too is, okay, so my skill levels can be very different. I do have a girlfriend who she is a NICU nurse. Taylor came on and we talked a little bit about this. The reason I feel like for her being in this program for NNP and doing it like long distance essentially works is because she's been a NICU nurse for so long. So she has done and seen and worked with intubations and doing all of these skills. And I know that she's going to work with someone that is going to teach her that skill level really well. But she can't rely on the school, basically. She's not going to be doing skill hours with them for that particular thing. Her skill level is just different, but she's been a nurse that long. She has a lot of really great resources. That's another thing I want to touch on for my purposes of doing the master's program is I have a really great network. And I think the longer you're a nurse, the stronger your network becomes. And so I'm at the point in my career where I could ask someone, like as far as following them and shadowing, I could kind of I'm planning on tapping into my network, my people. And, you know, here's the thing. Am I going to get rejected we're going to find out how this goes. I don't have the perfect answer. I don't know how it's going to go yet as far as finding my clinical sites.
Right.
We're going to see how it goes. Yeah. But I like the idea of targeting places that I know I'm going to want to work. I'm going to have to do my own research and I'm going to have to do all that, but I've already started doing that. I've already started looking around what's available in my area. What are some places that have good reviews that I would think I would maybe reach out to them and say, you know, would you feel comfortable? I have girlfriends in programs that I know take students. So there's a lot of that dynamic. And I think those are really important to consider. You know, some people really like the idea of the model where schools choose. I think there's an up and a down to it. Like, what if you hate your clinical site?
100%. I had some people in my program that absolutely hated their clinical location. And I just got so lucky and I had the best pediatricians that I was training with. And I did pick the nurse practitioner that I trained with for my specialty rotations, but I got so lucky with my primary care. I learned so much, but I do know that there was people that didn't. So on the second semester, they were like, okay, you know, I'm done with this. Let me pick my own person, you know, so that can happen.
Yeah.
That is, it is kind of a crapshoot and you either get lucky or you don't. But I would advise people, anybody who is starting like an online program, before the thought of clinicals even comes up with your program, you just start asking people. Start texting your friends who are NPs, start talking to people, oh, like, would your pediatrician that you love, you know, for your kids, would they take a student? You know, and just like you said, start tapping into your network and asking. And then remember that sometimes the contracts between a school and like a private clinic or a hospital, that can take a while to kind of get going. And the process can take kind of a long time. So just get it done early so you're not stressing going, oh my God, I can't get my clinical hours done. You know, you're already stressed enough. So
what are, for you, do you feel like are some cons to
going to school in person?
Yes.
Okay. One would be just like the commute there and back and like having to bring kind of my life with me. So the first semester I had school 1 day a week. I did have an option to do it 2, like if I wanted to, but I was like, no, I kind of wanted to just block out, do it 1 day a week. And I had to bring, you know, my lunch with me. I had to bring all of my stuff in my backpack. So but, you know, you're on campus, like 27 years old, and you have these like 18-year-old kids like running all around, you know, it's kind of just like sometimes can be a weird dynamic. But I think that would probably be one of the biggest cons is just like the 30-minute commute there and then sitting in class and then having to like bring all of my stuff, you know. But other than that, I have like basically pros, you know, to all of that.
So for my con, I would say one of the biggest dynamics I didn't really anticipate was sort of like not having that student interaction or not having like, I don't have like friends that are with me in it, you know, like that's a big dynamic. And I do think that that's a big part of nursing school where like regardless of what route you're in, it's nice to have someone to lean on. You just don't really have that dynamic. I would say also the fact that some schools are a little different in the way that they're set up. Mine is very much self-paced, so I just have to be very disciplined, and it's hard for me. I'm going to be honest about that. Like sitting down on a Monday and Tuesday and being like, these are my school days. It's like,
like I'd rather hang out with Jacob.
Yeah.
Like I'd rather go hang out with my friends.
You have to be very disciplined.
Yeah.
You have to be really disciplined. And I'm in the hardest class, and I'm pharmacology. I'm in that right now, and it's so much material to go through, and you don't really have that person to. I mean, I can email my professor a question, but I don't have that access all the time, and so it's a big thing to consider. You know, like that's a real part of this program is like you have to be very self-sufficient.
Yes, I know. And I honestly like shout out to my classmates because I don't think I could have gotten through my program without them. Yeah. You know, and we kind of had a bad deck of cards dealt to us because our program changed a lot. And then we had a pandemic. So we really leaned on each other and we got close. But that's actually a super good point. Like, my friend and I would split the study guide, and I'd be like, okay, you do the first half, I do the second half of the study guide, and then you have it, you know. Or like when we were studying for our final exam, everybody's like sharing resources. And even now we have this network of a group of people who are going to go on and be NPs. And if we want to leave our job in the future, I can just go text my friends and be like, hey, who's hiring, you know? Or right now we're just commiserating like, I don't have any purpose right now because I'm done with school, or you know? So it is, if you know that you kind of thrive off of that and you don't have a lot of like self-motivation, I do think that maybe leaning towards some type of in-person program, or maybe just like, you know, one of your coworkers wants to do an online program and you're like, oh, let's just do this one together, you know? Some other cons that I just thought of while you were saying that is of in-person programs is some people don't live near, you know, universities.
Yeah.
So their commute would have been much longer. Maybe the universities near them are completely impacted and they can't get into those.
Yes.
Maybe the universities like mine, you have to take summer breaks and winter breaks and they don't want to do that.
Yeah.
I know my classes, I had to take every semester 12 units, which was 3 to 4 classes. And from what it sounds like with yours, you kind of take a chunk of class at a time.
Yeah, so
that's
mine
cool.
is rolling year round. Okay, not every FNP program is like this, but the way it works is it's year round. I do one class at a time, which I do like. And I have a week off in between each class. And then I have a 5-week winter break, but that essentially means you're going year round nonstop. Like for Taylor, who's in the NNP program, which is the same school, she is doing 3 classes at a time, more traditional with a summer off. So I do kind of, there's definitely pros and cons to that as well.
Yeah.
Like it's just, I'm technically, we're on summer and I'm in school,
yeah,
you know, like
right.
I still have to do everything. And, you know, so, and the other thing too is my classes are they're fast paced.
Yeah, that's what
Very
it seems
fast.
like. Like I had a whole 13 weeks to learn
Yeah.
pharmacology and you have how many weeks?
I have, technically it says a 10-week, but
it's hard when you're not in person.
You
have to teach yourself.
Yeah, it is. It's very, very, it's a lot.
So does your professor, so like, you know, everyone knows the way that in-person classes work. You like show up to a class, they lecture you, they ask questions, you know, all that stuff. How does it work with your online class? Like you have a video of a lecture or...
Okay, yeah. So that's a good point. So, okay, the way that works is pretty much majority of it is you have something due on Wednesday and then things due on Friday or Saturday. That's just a standard in the program, right? So it's self-paced. Everything is self-paced. I don't have to sit down and do necessarily like a Zoom, you know,
that's
PowerPoint.
Nice at like a certain time.
So everything, you know, there's a PowerPoint with a videoed, basically audio of the actual PowerPoint. So you go through it self-paced and you listen and you write notes and, you know, you can print out your lectures and things like that. This particular class, the professor, she will come on and she'll answer questions in a Zoom if you want to. She'll also post the Zoom so that way we can watch it later. So if you can't make it, you can listen or watch. I do have access to a coach who can help me through and answer questions that I may have. But it's not immediate, you know, it's not like you're in a lecture and I can ask that question right away.
Yeah.
I will say something that's kind of interesting is I'm definitely a lot more engaged at work when I'm talking to my doctors and my NPs and PAs. Like if I have a question about something, I will genuinely go and ask at work sometimes. Like I'll be like, hey, like, can you explain this to me really quick? Because I just want to understand it. I also
You're so good at that, but not everyone is.
Yeah.
You know?
And well, that's a big dynamic. I think like I'm really changing my mindset when I'm at work and being like, okay, if I was a provider outpatient and I was taking care or like admitting this person, like we just had a baby the other day who came in. Billy was sky high, all, you know, bruising, and, you know, turns out this baby has a disease process. And I'm like, that would be me possibly, you know, detecting that. And so you just kind of change your mindset. And then, you know, you go in and you look at the note and you see what the provider wrote and you kind of like, you're changing and shifting and really like getting engaged with that mindset, I think is really important. And the other thing, I mean, for me, as far as study tactics, because I did get this question for study tactics, how do you study?
Yeah.
So, I obviously, you know, I listen to lectures, watch lectures. I really try and go through round 1 and like listen to it, understand the general concepts. And then I go a step further and then I will usually go through and pick out the topics that I really don't understand that much. I use a lot of Picmonic is like, it's my thing. I love Picmonic. That's my visual audio, you know, and then also Recall practice help with testing. Like I genuinely,
especially for farm and patho, you got to like make the flashcards, write it down, and like go through it.
I do have flashcards as well. So those are kind of some ways that I really, and then I go back and then I will do usually a round 2 of listening to the lecture again and just try and go through it. So, and I do try, it's like very self-paced, I still work 2 days a week. A lot of us work on, most of us work through grad school. Yeah. As a nurse. You can't do that necessarily
unless you have like a sugar daddy who's like paying your way through, which
or a parent
we don't.
Who's like, here, we'll pay. Like, no.
Right.
That's
right.
Not. And I think it's still good to work through grad school.
I think so too. It gives you something else to do. But so study tips. I get that question a lot as well. So online is a little bit different than in person. Yeah. So once you're out of the classroom and you can't hear the lecture anymore, you're kind of like, oh crap, I have to depend on my notes that I took in class. So I used to write my notes when I was in nursing school because I didn't bring my laptop. But now it's like everything is, downloaded off the you download your PowerPoint and then they go through the PowerPoint together. So for study tips, so when I do in-person lectures or when I, I'm in class, I, with permission, I record the lecture so that while I'm taking notes, I don't get too like bogged down with like the exact thing that they're saying so that I can go back and listen. Yeah. Another thing is sometimes I just get bored of sitting, on my couch or at my desk or wherever I was studying. And so the recorded lectures I take with me and I go on a walk or like I go to the gym.
That's another thing I was going to say.
Yes.
I'll listen to my lectures on the way into work sometimes.
Love that.
Yeah.
Yeah. And I just like thrived listening to my lectures like while I was at the gym, just feeling like I can multitask.
Think about it while you're not. Yeah. And it's like you
engage think of it in a new way.
Yeah.
Mm-hmm. Yeah, for sure. Yeah. It kind of just helped get me off the couch and get my brain working in a different way. So I did that. I would print my PowerPoints and I'm a huge like highlighter. I would rewrite the notes. I'm a huge like if there's going to be something that I need to remember, like an increase in lymphocytes means that it's a viral infection on your WBC. I'll be like, okay, LV. The L goes with lymphocytes, the V goes with viral, LV, Louis Vuitton. There we go. That's how I remember it. Like just little things like that.
Finding the things that help,
Yeah, I am all about like the little acronym things. There's stuff all over the internet, like remembering Kawasaki, like crash and burn.
Yes.
So I love that stuff, which I think Picmonic.
Picmonic's a great one.
They have some free, like I feel like they had some free ones on YouTube because they had a developmental one that I watched.
They have a lot of resources. Yeah. The other one I was gonna say that I've been using that I love
Khan Academy.
That one's good. Khan Academy is really good.
Whoever does Khan Academy is so great. Like, oh my god! Shout out to Khan Academy for getting me through. School.
Khan Academy, Picmonic. And for farm, I love Hippocrates.
Oh yeah.
Oh okay. My god. Okay, so a lot of people
do you have the Hippocrates app?
Yes. But okay, so I do pay for it now, but okay, so Lexicomp has one, Hippocrates. The other one is Up to Date, but Up to Date, you have to get approved for it, and I haven't gotten approved. I don't know. It's
you have to pay, and I heard Up to Date's very expensive.
Yeah. So Hippocrates is a little expensive too, but I really like the setup of the app. The app is like you go into it and it's got some pictures with some things. It's got some like I'm obsessed with it. So this is my new thing, like acute sinusitis, and then you go into the treatment options. There's exam history, tests, differential diagnosis, follow-up, prevention, complications. Like so it goes really in depth. There's a lot of great things on there.
Speaking of apps, Medscape is another really good one too. Okay. So I used Medscape when I was in clinicals. Oh. That's a really good one for clinicals. And
another one you used?
What is that one? Yeah, I have a ton actually. Medscape I loved because it's free. PD Quick Calc is really good for peds. It's like good for drug calculations and then just looking up meds and what their doses are.
Yeah, the Hippocrates has that as well too. Yeah, so that's a good one.
I thought it was free, but you actually do have to pay $5 now, I guess. But it's so worth it.
I was gonna say it absolutely. To me, sometimes these apps are, and what I liked about my program too is they're very open about the fact that they're like they want you to be realistic. So like we started my first week in farm, we were writing pretend prescriptions like right away.
Yes.
You know, and they're like, here, use these apps. They encourage you to use the apps, which I'm like, thank you. Like, this is real life.
Yeah.
Like, everyone's using them now, and this is like real life med. Like, this is how we're doing it. So, you know, that's something that I do like about they're realistic in a lot of things.
We do that too. Or we did do that too, I guess, in our program. And one thing that I do like is just kind of that switch to being a provider from a nurse. Like, we aren't allowed to have our phones. Like, you're like, if you're a nurse, like bedside on your phone, I don't,
like,
you could get,
big
it's
no-no.
a huge no-no.
Yeah.
But then all of a sudden, you know, when you're a provider, that's what you have. It's in your pocket, and you just kind of pull it out, and you can, there's so many resources on it. There's your calculator, and there's your apps and all of that stuff. So
the world is on your phone.
Yeah, it is. It's really nice.
Have to find the right resources, but yes, they're there.
Yeah.
I know they do encourage it.
I'm going to put a bunch of like great NP resources. I have them right now on my Instagram, on my link tree.
Okay.
I have a ton of NP resources. I have a ton of PICU resources. And then, you know, when I do launch my blog, I'm going to have just like a whole section for like, here's your resources for studying, and here's your resources for like specifically NP and clinicals and things like that. Because I have, you know, all of these apps, like you're saying.
Yeah.
You kind of just have to learn like word of mouth, or someone tells you about it, or
I
whatever.
know, and that's why I wanted to have this conversation.
Yeah.
We need all these resources and these tips.
Yeah, for sure. Well, and up to date, like some programs or like some med schools will give their students access to up to date. But if you try to pay for it on your own, it's like over $1,000.
It's a lot.
Some hospitals, when you start working there, or places that you work, will pay. And up to date is like, you basically just like type in maybe your symptoms, or you type in a diagnosis, and then it just gives you like, okay, here's what you do. And it really breaks it down for you, but it's expensive. And so I didn't want to lean on that too heavily in case I wasn't able to use that when I become an NP.
It's important to have that like base, a good, really good base. Yeah, for sure. So
we talked about study tips.
Yes.
Okay. We talked about why we chose online and in person.
Right.
What other things?
Bring it down. You know, cost is a big one. And the other thing too is like, it's a balance, I would say, like of timing of when you go back, or like maybe family planning. I mean, I feel like maybe for us, like obviously we want to have kids.
Yes.
But I wanted to get through the majority of school before I embark on that. So, you know, it's sort of like timing. You kind of have to you definitely have to think about that. I mean, if, you know, I want to have kids, I want to be engaged with them when they're home. So there's a lot of factors of why and when, and, you know, what route and things like that. And so I think it's, you know, it's a balance of getting your feet wet as a nurse, thinking about what you want, and if you're happy where you are, great, do that. If you want to move on, then, you know, you just,
seriously love that. And find a good mentor who can really like guide you in a way and encourage you, or just kind of be real with you too. I feel like that's like such a huge thing. Like you were talking about that before.
You know, being smart about where you're going, or just maybe kind of doing some quite a bit of research, talk to people, do your referencing, or,
even like reach out to programs and ask them like, do you provide clinical sites? Like, what do you do for this? What do you do for that? I mean, we both probably get so many direct messages on Instagram, which is great. It's so fine. And we love answering that, and we love, you know, meeting people and doing all that. But there is something to be said for kind of just reaching out to those programs or going on their websites. Yes. Does it take a lot of time? Yes. Yeah, it does. It does. Yeah. But, you know, start this early. Like, you know.
Talk to people. I mean, I now, especially in critical care float pool, I feel like I am now getting more access to more NPs, to more PAs. I'm just sort of asking about their journey, like how they did it. Do they like it? You know, it's just been kind of fun in that way to really, you know, I think both of us have talked about this, network. I mean, here I am. I made so many decisions, like with the encouragement of talking to you. That's networking, literally. Like I am such a big believer in, you know, asking and getting out of your comfort zone a little bit if that's what you need, if you're at that place. I'm a big supporter of that. Like complacency is a killer. Like I don't tolerate it in my own life, and I don't think anyone should. I think if you are at a place where you feel need to get challenged in a new way, do it. Like life is too short. You know, and even let's say you make a mistake and go back, who cares? Like you did it and you tried and, you know, it didn't work out. Great. Yeah. You learned something.
Yeah. And don't let the negative Nancy's get you down, because I don't know how many people, I mean, coming from PICU and then going into PNP, I get so many people like, oh, I heard there's not any PNP jobs. Like, it's like they're like projecting their, I don't know, like insecurity of not doing that onto you. Yeah. And they like want a reason. They want you to be like, oh yeah, you're right. You know, when I graduate, there's going to be no jobs. Like, you are correct.
Yeah. No, but I agree with you. And it's funny because it's like, have you even done the research to look? Like, do you even know, you know, I mean, I don't know. I just don't, I can't let the, don't let the negative Nancy's get to you. Yeah. I agree 100% on that one.
Yeah. Well, and PNP and FNP, like so many people are trying to decide, especially when you're coming from pediatrics. Like people are like, well, I'll be more marketable if I'm an FNP, you know, and I can still work with peds. And I'm like, yes, 100%. And I decided the PNP, the pediatric NP route was for me and not the FNP because I will never work with adults. Yeah. And so even if I could be more marketable and those jobs are out there, I don't want them. Yeah. Like, you take them. That's fine. Yeah. You know, I want the jobs with just kids, you know, and so that was what worked well for me.
You know what? And that's the thing is, like, there's going to be a position out there for you somewhere there. You know what I mean? It's like when you put your intention to something, it's gonna work out. 100%. I'm sorry. Like, if that's what you want and that's a space you want to get into, and there's gonna be something there for you. Yeah. Well, 100%.
And P.S., if anybody's listening in the Southern California area and you are hiring a pediatric nurse practitioner, I just graduated.
Shout out, Natalie.
Some people say I'm pretty great.
Yeah, you are amazing.
No,
you had a job. This is all pre-COVID, by the way. You had a job.
Right, I know. You know, honestly, I feel like you said, it's the network and those jobs. Maybe peds is suffering right now. Those jobs
everybody is. We're all. You know? I mean, that's real talk. COVID is actually slowing down everybody in so many different ways.
Right, I know. But you know, it's been kind of a blessing for me because I was so, you know, pedal to the metal constant for 2 years straight. And we can get into this because I know you want to go micro, like you love to say.
Go micro into this.
Yes, so let's go micro on.
Yes, please. If I had to sum up my style, I would say it's simple, sleek, with a statement. I really value quality and looking sharp, and yes, of course, that includes the hospital setting. Let me tell you about my latest favorite scrub picks. So, no secrets here. Of course, this is a Barco Grey's Anatomy line. This is their signature shades collection. Holy smokes, new level. So this is a modern fit with a really nicely tailored look. My top 3 color picks, I would say, of course, black, wine, and a really pretty gray, almost concrete color called Shadow Shade. Stunning. So each of these has a really nice collar. It's sort of a V going into your collarbone, really, really nicely tailored. Then the front has 2 nice pockets. There's one pocket down on the side where you can put all of your pens, or if you have a pen light and things like that, your scissors, whatnot. So this is by far one of my most favorite lines right now. Of course, you guys know I also love the Edge line, very sleek. No secret here, I am a look good, feel good kind of girl, and I feel like $1 million when I walk into that hospital every day. So I'm a proud partner with Barco Uniforms. Barco Uniforms has been in business for 91 years. Thank you very much, Barco, for your paid partnership and allowing me to help produce this show. If you guys are interested in heading over to check out a pair for yourself, head over to www.barcouniforms.com and find a retailer near you. All right, you guys, let's get back to the show.
So at least for my program, the first year was completely just didactic. So by that, I just mean is just lecture. Okay. No clinicals, any of that. I want to say like 10-hour days just because of the space in between classes. So I would go to like my patho class, and then I would go to cultural diversity, and then I would have like a 3 or 4 hour break in between. And so my friend and I, who works at our hospital as well, she and I were in the program. We met on the first day. She was like, "Oh, do you work here?" And I was like, yeah. And she's like, "Okay, let's be carpool buddies and friends." And so that was super fun. Yeah. But we would just drive home and like take a nap or cook lunch or something in between classes, and then we would come back and we would finish our day out. The first year I worked Sunday, Monday. So I was in the critical care float pool. I was per diem. So my shift requirement was 6 days a month. But I would put myself on for extra shifts because at the time, like, you could just kind of pick up whatever.
Yeah.
So I worked every Sunday, Monday, which was the beautiful thing about being per diem. They can't change my schedule. I would have Tuesdays off, go to school Wednesdays, and then I would have Thursdays and Fridays off. Sometimes I would pick up extra shifts on like that Friday, you know, or Saturday or whatever. Right. Some people don't like that because they have to work every Sunday of the month. But to me, finding a routine was absolutely life-changing.
Yeah.
And as nurses, we don't always get that. We're like, oh, I work Monday, Tuesday, Friday, and then the next week I work Thursday, Friday, you know, and I have to do my weekend requirement and this and that.
Right.
And for the first time, because I had talked to my manager and I kind of told her what's up, I'm like, hey, I'm just going to put myself on the schedule every Sunday, Monday, you know, is that cool? And she was like, sure, like your schedule doesn't get changed because you're per diem. So I did that on my days off on Tuesday, Sunday, Monday when I work. Honestly, I don't know about you, but like I get nothing else done. Yeah. You know, like unless I had like an easy day with like a feeder grower or something and I could kind of review things, but I use that day to like plan my week out.
I just feel like for me at work, I just never, some people, I think night shifters can do it. And I also shout out to all the night shifters who are in school. I'm like, it's so tough. I don't know how they do it.
Yeah, no, I switched to days when I came back from travel nursing because night shift, I'm a monster. You know, Eric called it night shift Natalie because she was like, get out. Totally. Yeah.
I would be so loopy and slightly crazy, but
people do it.
Yeah, people do it. Yeah. But I would agree with you. I feel like I can't do it at work. I can't. I don't focus.
Yeah, and I can't really like work out after work or anything either. So, you know, eating healthy, having a healthy lifestyle, working out, I knew that those would be important for when I got back in school. So the summer before, actually, I made it a huge priority in my life to just get my butt in the gym, get a gym routine, get a good eating routine. I follow Katie Yovan, who's like a friend of a friend, who's now this like amazing Instagram fitness person. And she has like good 8-week challenges. So I would just buy those, do it with my girlfriends. We have like a little group chat where we all motivate each other to like go to the gym and eat healthy, and we share healthy recipes and stuff. And so because I had that regimen and also somebody kind of telling me what to do, so I didn't have to use that extra, you know, brain power to be like, okay, well, what am I going to do at the gym? It's like, it's already listed out for me. So I thrive with stuff like that. And so once I realized that, I ended up buying this like meal prep app off somebody that I like found off Instagram, and she like will make your meal preps for you, and you can kind of choose like what you want to eat and stuff, and then it'll give you a grocery recipe. And so for me, I was like, I think it was like $5 or $6 a month or something like that to do it. And I was like, that's great. Like, I just need somebody to tell me like, this is what you need to do because I'm trying to transition to get back into school. Because it is kind of a shock. Like once you go back to school, it's not like nursing school. It's not like undergrad. It's different. For sure.
It's different. I feel like it's easier in a lot of ways, and then it's harder in some ways because it's like getting back into that mentality is really hard. My tips, I would agree. I feel like having a workout schedule is huge. I am getting back into working out. I feel like I took a little breather for a minute because I was just burnt out on everything, but it feels really good. I've been doing a lot
when gyms open back up.
Yeah, exactly. I've been doing a lot of body weight stuff. Like I follow Sarah's Day. I also follow, there's a couple different influencers that I follow that do a lot of body weight. Nice. Great HIIT workouts. So I've been doing a lot of those. Yeah. And then Jacob and I will go through stints of ordering meal prep. We order from Territory. I'm not affiliated with them, but I love them. They're like, the flavors on the foods are really good. It is a local based like LA and Orange County service, but you know, I do use hacks. Like we get someone, I can't do everything. And I think that's part of what like, you know, so it's like, we do have someone come in every other week and clean the house. I can't do that. I don't have time. Yeah. You know, there's certain things that I've put in my life to help kind of make it a little easier. I have a little bit of structure in my schedule. I know Mondays and Tuesdays are my school days, you know, and then I have, you know, an extra day for studying at bare minimum.
Yeah.
So it's just finding those things, I think, that really help your life. I mean, I know a lot of people that have kids and, you know, they're in grad school, and there's so many different walks of life that are in NP program. So you can do it. It doesn't matter who you are, you can do it. You just have to make it work.
Right. And you might have to like outsource, like you were saying, some of those menial tasks that you're like, I just actually don't have time.
Yeah. I don't have to. I physically don't have time to do that. So I'm like, well, okay, I have to pay someone to do it. All right, fine.
Right. So my last year when I was in grad school, it was clinicals and lectures on top of like the papers that you need to do and the homework and all of that stuff. So once you add in 3 days of clinical, 2 days of school, and a day of, wait, I lost count. 3 days.
You're like, how many days of the week are there?
Been out for school for too long. 3 days of clinical, 2 days of work, and 1 day of school. That leaves you 1 day off a week to like try to catch up on everything. It just was not manageable for me. So I went back down to the 6 days. Like I didn't pick up any extra shifts unless, you know, the nice thing about nursing is I could be like, hey, can I cover half of your shift or whatever?
Totally.
So I did the 6 days. I, again, made sure that I had a routine. So I ended up working every other Friday and then every Saturday, which sacrificed. But clinicals, Monday, Tuesday, school Wednesday, which went from like 4 p.m. to 9 p.m. Brutal. I would take Thursdays off, and then I would either have clinical on Friday or I would work.
Yeah.
So the nice thing about clinicals is that if you're doing outpatient, they're 8-hour shifts.
Yeah.
Which is also the kind of not the great part, because then you have to do more days to get like more hours.
Right.
You know, like instead of just doing 1 day and get 12 hours. But once you're done with your 8-hour shift, you're like, oh, it's 3 p.m.
Yeah,
like
so
I can go run to Target. I can't, you know.
It's such a different from my shift.
Yeah. It's so light out.
Because I commute to our work, and I don't get home at night till like 8:30.
Driving
usually.
here, I was like, oh my God, Tori. No wonder Tori comes in like
5 minutes every day. Sorry, charge nurses, I love you.
Oh my God. No, I do the same thing. Like, honestly, I'm not a morning person at all. And I
have a chronic late problem anyway. If I have a real flaw, let's be honest, I'm late. I just life is late for me. I'm sorry, guys. Like, just facts. I'm not even gonna lie about that, okay? But yeah, it's a far drive. I don't get home till usually 8:30 at night.
That's tough.
Yeah.
Yeah, that's a late.
I mean,
by the time you calm down and then you shower and then, you know, you barely even have time.
I will say part of it too is, I mean, driving in and driving out, like it is kind of nice because I do detune a little bit and I don't deal with as much traffic as other people, but
nice.
And I get a little podcast time, you know, it's like, it's kind of nice, but
there is something to be said about a commute if you don't have traffic.
Yeah, different.
Yes. Yeah, for sure.
But the 8-hour days, it's sounding better and better for me.
I know, I like it. And so some of the clinicals that I was at, the lunch breaks were like 1 to 2 hours.
Luxury.
What? This is crazy.
Know. When you come from a place where you literally are begging for half an hour.
Yes,
it's
I know.
like literally
5 minutes of it is getting your lunch out of the refrigerator and having to warm up your food.
Yeah, and if you need to go down to the cafeteria.
Walking to the cafeteria.
You're like, that's half of my time off right there.
Right.
I mean, 30 minutes is nothing for your lunch when you're...
Are you a cafeteria girl?
I am. A lot of times I am.
I am a bring my food to work kind of girl.
I know.
But
so good.
honestly, I think most of that started just from being in a routine. It's like, you know, I pack my lunch the night before. I even like set out my scrubs, my underwear, my socks, like everything that I need. I set out because those precious minutes in the morning, I could be sleeping, you know?
I will say the prep for me in the morning is critical.
Yeah.
Because I literally am speeding out the door late whatever. But lunch, lunches I go through phases. I'm like such a phase person where like, okay, we do like, you know, a lot of salads from Trader Joe's, like all that. You know, I'm big on just things that I can grab and go. Lately, I just feel like I've been behind on life, period. And I feel very very fortunate that I have such a wonderful partner in life who helps keep me on track. And part of that, you know, whether it's meal prep or, you know, grocery shopping and like, you know, I mean, when you're in grad school, like you just can't function. Like it's just like there's certain things that you don't have time for it, and like your brain is somewhere else all the time.
Yeah.
I always feel bad when I'm with friends now because I'm like, I have this assignment due, I have that, I have, you know, I'm still
It's great
working.
that you like still have friends, by the way.
Yeah, I don't even
like
know.
like when this whole like social distancing thing happened
know.
a few months ago, I was finishing up grad school and I'm like, wait, I'm already doing these things.
Yeah,
like
yeah,
I
yeah.
already don't see people. I already don't go
Fine.
out. I already am stuck
I'm
at
already
home.
technically in quarantine. It's fine. Yeah, I feel that. Like you don't have time. I don't have. I feel bad. I mean, it's actually good timing because a lot of my friends are actually having kids and like their lives are so much more busy. It doesn't matter anyway. But I still feel like a bad friend sometimes. I'm like, but anyway.
Well, actually, no. Let's talk about this because this is so real, and I talked about this a lot with my friends that I went to school with. You have to have a good partner when you go through this because I leaned a lot on Eric. Mm-hmm. He jokes that he has caregiver fatigue after my 2 years of grad school because the amount of stress, the clinical hours, you know, the exams, it is a lot and it weighs on you. And then you also are going to work. Oh, and guess what? Like we also were planning a wedding. We were also, you know, you still have to pay rent. You're still the one cooking. You have to do laundry. Yeah. Which, side note, that was my favorite like little hack is that I found a place nearby where they would pick up our laundry, take it, wash it, fold it, and bring it back 2 days later.
Holy smokes.
I know. It was $50, but I was like,
worth it.
That's time a month. I was just like,
but here's the thing. You got to be efficient, right? And it's like, I'm not a big believer and you can't do everything. And to make your life more efficient and to work for you, like you just have to do those. Yeah. I'm a big believer in that.
Yeah. If you can afford it. And I totally get that some people can't, but.
And, you know, I feel bad for the, you know, for the people out there who you're going through grad school and you don't have a partner. Like, sometimes maybe it's like easier, different in different ways.
You
don't but I will say, I agree with you. Like, I feel very lucky that Jacob has been very understanding and very supportive.
Yeah.
Because, it's a lot. I mean,
our partners need like a grad school, you know, caregiver anonymous to go to just be like, okay, so Natalie cried for the 5th time this week and she's been a total bitch
crazy
because she's stressed.
Yeah, it's stressed. I mean, it's a whole different ball game when you're, your mindset, your mind is other places, your
especially
priorities.
Right now with COVID happening.
Yeah, that's a lot.
You know, there's a lot going on. So I think like you said, you need either your partner to lean on or you need somebody to go to. You do need to take care of yourself. I'm glad you're getting back into like working out if that's what makes you feel good, putting good things into your body, putting good things into our hearts and our minds. Like I got off Instagram for like half a semester, you know, because I was like, I can't be scrolling. And
and I think a lot of providers, I would agree with that. My dynamic is changing a little bit where I do have to like step away just mentally, period. Like social media for me is like, it's a love-hate. Let's just put it out there. Like it's something where I find a lot of inspiration and I love it. And I love putting out information and being a resource. And then there's a lot of, especially right now, just with everything going on, it can be a negative Nancy. So I'm like, I kind of have to, you know, putting things on hold and finding the priority. And my priority right now is to be a provider. And so school's coming first. I actually delete the app on days when so sometimes I'm like, I just need to like delete, just be off of it for a second and just like not have access to it. Sure. And then I download it like, you know, the next day. But it's just those kinds of things that you kind of
give yourself a healthy boundary. Yeah. I had Eric change my password. I'm like, do not give it back to me until, you know, finals are over or whatever it is. Yeah, this was pre, you know, Instagram influencer. That was when no one really cared, you know? Yeah. But, I love that. Yeah, no, I think that's like something healthy to do. And I think that finding ways to cope with stress is so important. And we don't realize how stressed we get until you're like in it, you know? Now that I'm out of it, Eric is like, oh my gosh, you're back to yourself, you know, you're like happy and you don't have this like weight on you, you know?
Yeah.
And I have a different, you know, kind
I'm
of.
in that weight right now,
You
girlfriend.
are.
Like,
I
get
know.
it. Oh,
I
it's
totally
so
understand.
tough. Yeah, it's tough. Yeah.
But you're going to get through it, you know?
Yeah.
Like the only way out is through, and it's going to feel that much better that
it will
you know,
be.
put the time in.
Light at the end of the tunnel. You just focus on that. It's hard sometimes, you know, but it's good, and I agree with you.
Yeah, short-term sacrifice, long-term gain.
What is your best piece of advice for upcoming, maybe nursing student, but also maybe anybody like healthcare, or just sort of, what's your best piece of advice?
My best piece of advice, let's see, I would say don't be too hard on yourself and be humble about things.
Yeah.
You know, we're all learning, we are all growing. Forgive yourself for not knowing information, but having the, I don't know, like pride or the self-awareness to like ask for help when you need it, you know, and just be a constant student of life, be a constant student in the hospital, ask questions, be a sponge, you know, talk to people, ask them questions. It's all just like, we are all in this just like pool of learning and growing and, you know, kind of like riffing off of each other. You know?
I love that.
Just know that.
I love the riff.
Yeah. And there's no, kind of like we were saying, like there's no right way to do things.
Yeah.
I feel like maybe there's a wrong way to do stuff. Like if you're totally just like competitive, you know, and you try to push other people down to like bring yourself up.
Yeah.
You know, but I do wish at the beginning somebody maybe told me like nursing school and nursing just from like a nurse perspective is not what like a zero-sum game, meaning your success does not mean my failure.
Right.
You know, like if you kind
Don't
of
judge.
have that idea of that Tori can do great and I can do great, you know, like let's work together, because healthcare is not just one person knowing all the answers. Healthcare is a bunch of people, you know,
Working
taking care of a
together.
person and collaborating.
Yeah. I think that's a really good piece of advice.
Yeah. What's your piece of advice?
Oh my gosh, such a loaded question.
I know, it's so hard. I feel like it's a little easier to answer the question if it's like specific.
Oh no,
Let's do this. What's your piece of advice for somebody like me who is like an up and coming social media? I don't mean to call myself up and coming.
No,
but
you,
like,
you are though. You're doing fabulous.
like a new person to social media. Like what advice? Because you've given me advice like off.
We've talked off the record. We've done
off
a lot of that.
radio, off podcast.
I think my biggest thing, honestly, when I just get down to it, is being a positive light. I just think when you get down to it, it doesn't matter what your message is. It doesn't matter. To me, I'm like, I think there's room for so many people in social media. I'm a big consumer of the Skinny Confidential. If you're not listening to this podcast, it's my favorite one, the Him and Her show, with Lauren and Michael. And she's a big believer in just erase the word saturated from your conversations. Like, it doesn't matter who you are, what space you're in. There is room for you. There is a lot of, I just think that being a positive light is the most important thing. Like, I don't have room for the negativity. And I think regardless of who you are, where you're going in healthcare, if you're a mom, if you're not in healthcare and you're listening and you're just enjoying this, like, I just want to be a positive light to people. And I think that's something we just need to really, really, really focus on right now. Like, being, what can you bring that's better to whatever space you're in, and to be a resource to people, and, you know, just sticking to your message. And I don't know, I think that no matter what you're doing, like, you'll find your way, but sticking to your voice, find your voice. And
yeah, that's really good advice. Yeah, I love it. Yeah. And then find your like tribe.
Yes,
of like
I
people.
love the tribe. That's the other thing too, is I focus so much less on expanding. Like, I don't want, like, expanding is far less to me as opposed to what I'm giving to my people. I love the girls. I mean, there's girls and guys, and my whole community is, I just fucking love you guys. I can't say enough about it. Like, I just feel like we just making this amazing space with these people and being able to like this is why I love social media, and I'm so passionate about it, because I feel like I've met so many amazing people. I have learned so much from different providers. I have expanded my network. I just feel really lucky, and really focusing on making and developing those relationships with the people that are with me. I love you guys, and I think that's part of what makes it so fun, you know, is being able to have and build that community.
Yeah, really you have cool. a great community. I think, like, you know, the Nurse Tori selfie show is just like such a great thing that you're doing. I think people love you. You're doing awesome. Top of the charts.
Yeah, thank you.
You know, so many people are proud of you. So many people are learning from this podcast. You know, I love listening to it.
Thanks.
And I do think that I would have to tell all the nursing students listening to this, or people who are going into nursing nursing school is the worst part of nursing. Yeah. Absolutely.
Everybody will say that.
It's hard. Like, you kind of just get through it. And then, you know, as you've seen on this podcast, so many different nurses and people coming on, you'll have so many different opportunities. There's so many great ways to take care of people. There's so many ways to influence people. There's ways to leave your mark in this world as a nurse. And that's, I think, the coolest part of nursing. I know. You know? We're doing it now, hopefully, and we will continue to do it as nurse practitioners. So heck yeah.
We're going to have to follow up when you and I are on the other side.
I know.
I'm really excited about it. Can't wait.
I know. I'm really excited. Thanks for having me today.
Oh my God. Thank you, Nat. Okay, so pimp yourself out. Where can everybody find you?
Currently, everyone can find me on Instagram. It's at Natalie_PNP_.
Yay.
So that's where I'm at, and I actually am thinking about launching my blog very, very soon. Yay. I don't have it all, you know, up and running quite yet, but it will be at nursenat.com. So you'll be able to find, you know, all of the little tips and tricks on grad school, PNP, travel nursing, nursing school, you know, all the things. Yeah. And I'm really excited about that. So I hope, you know, this was helpful for some new nurses and some travel nurses and people thinking about going to grad school. Like, that's a huge step. So
it is.
Hopefully talking it out with the two of us here in this very long form interview, you know, maybe gave people some confidence that they can do grad school too.
Yeah, you can do it too.
We can do it.
Hey, if I can do it, then you can do it. Trust me.
Yeah, if we can do it during a pandemic, anybody can do it.
Thank you, Nat.
Yeah, thanks, girl.
All right. All right, you guys, thank you so much for listening. I truly value your time. And as always, I look forward to bringing you guys more selfie shows. So the past 2 episodes have been completely loaded with information. So I have linked all of Natalie's Instagram, website, and resources below. If you want to check out her website, www.nursenat.com, definitely head over to check out. She has just launched her website and it is phenomenal. So thank you so much, you guys. I love you all. In order, as always, to support the show, please head over to rate and review the show. We love hearing what you thought. We really love your feedback. And this week we sent out round 2 of our selfie swag. So this is how it's going to work from here on out. If you guys leave us a review and you leave your Insta handle for us, we will be sending over you guys some super cute stickers and a selfie badge reel featuring Selena with our selfie icon. Be sure to be following us on our Insta at CELLFIE_podcast. Make sure to hit that subscribe button. You can find all of our episodes on www.tipsfromtori.com. And be sure to check out those show notes below. We have lots of information about all of our guests and our sponsors. And thank you so much, you guys, for listening. I hope you have a great week. Catch you next time.